Hi, I'm Andrea. I was diagnosed with type 1 diabetes in March 1997 and with celiac disease in August 1998, although I had lived with the symptoms of celiac disease for many years prior to being diagnosed.
Hi, my name is Jules. I'm a nurse and I'm a freelance writer. I happen to live with type 1 diabetes and also have a secondary diagnosis of rheumatoid arthritis. This is my 30th year of living with type 1 diabetes. And I also have a daughter who has type 1 diabetes and celiac disease. She was diagnosed at the age of 5, 7 years ago.
Hi, this is Dana. I was diagnosed with type 1 diabetes my freshman year of high school 11 years ago, and I was diagnosed with celiac disease about 5 years ago.
Hi, I'm Wendy.
Hi, I'm Addy and I'm 10 years old.
Addy was diagnosed with type 1 diabetes 3 weeks after her second birthday and celiac disease in 2008 at the age of 5. I was diagnosed with celiac in 2009.
My name's Brianna and I am an undergraduate student at the University of Michigan. I was first diagnosed with diabetes when I was 4 years old, and then the following year with celiac disease at 5 years old.
3 weeks after her second birthday, I took her to the pediatrician because she had been saturating her diapers with urine and drinking a lot. She was diagnosed with type 1 diabetes that day. We ended up leaving the pediatrician's office in an ambulance, and she was flown to an ICU, and we were at the hospital for about a week after that.
I developed type 1 diabetes in my third year of university when I was 21. I was used to being sick and the doctors not being able to figure out what was wrong with me, with what I didn't know at the time was undiagnosed celiac disease. So I didn't go see a doctor right away. The doctor that I did see finally wasn't very familiar with type 1 diabetes and didn't get back to me very quickly with my test results. In the end, I was admitted to the emergency room in DKA and spent 2 days in ICU before being admitted to the ward for the rest of the week.
My daughter was diagnosed after a quick illness, and we saw that she had elevated blood sugars, and probably about 9 months later we had kept our eye on her general health, noticed some changes, and realized that she was showing signs of type 1 diabetes.
When I was diagnosed with diabetes, it was right after I had the flu, and apparently I was sitting in a bathtub and I tried to drink the bath water and just wouldn't stop asking for more water. Lo and behold, a few days later it was obvious that I wasn't getting any better, and at that point I was diagnosed with diabetes, like my mom, my grandma, and my great-grandfather as well.
I was diagnosed with type 1 diabetes 3 months into my freshman year of high school, and I didn't know anybody else with diabetes, so I didn't know anybody who could say, you could do this.
I can identify symptoms of celiac back as far as childhood, but my main acute digestive symptoms started the summer that I turned 16. Twice I was admitted for a week where they did every possible test imaginable except for the small bowel biopsy that would have diagnosed the celiac disease. Once I was diagnosed with diabetes, I thought that life was going to get a whole lot better because I had a disease with a name and a treatment. So it took another year and a half, a university course in clinical nutrition, and my mother's celiac diagnosis for me to put 2 and 2 together. Finally, I went to see my mom's gastroenterologist. He did the small bowel biopsy, and I was diagnosed immediately.
We did have positive lab work for celiac disease upon her diagnosis with type 1, but it was a lengthy period of time before we actually had a solid diagnosis in our hands, regardless of all of the signs and symptoms that she had.
I can remember her being an infant, about 7 months old, picking up Cheerios off of her tray, and then she would cry and seem very uncomfortable, and she had horrible diarrhea diapers. I kept taking her to the pediatrician and they kept saying that it was normal. I mentioned to the doctor when we were in the hospital about all the tummy aches that she had been having. They tested her for celiac then and it was negative. So in 2008, her annual diabetes blood work included a celiac workup, and the celiac panel was positive. She had an endoscopy after that and confirmed her diagnosis of celiac disease at the age of 5 years old. After Addy's diagnosis, we had the entire family tested. My lab work came back positive. I had a biopsy, and in fact, I was diagnosed with celiac in 2009.
When I was diagnosed with diabetes, they found that I did have the antibodies for celiac disease, but I had no symptoms. And if it isn't broken, don't fix it, I guess. And a year later, I can remember one day in particular coming back from visiting elementary schools where the snack time snack was an Oreo. And after that day, I knew I'd never want to see an Oreo again, and I haven't since.
As soon as I knew that I had a diagnosis, I went online to Twitter and asked people, what could I eat? What did I need to do? And immediately people came back with responses. They gave suggestions for restaurants, grocery stores, things I could eat, what would make it easy to figure it out right away. And it was really different than my diagnosis with diabetes when I didn't know anybody compared to 5 years ago when social media was around and there were people telling me that I could do this.
The learning curve at the beginning of a celiac diagnosis is really steep, and for me, that meant I put my diabetes on the back burner for a while.
Living with celiac disease has actually become the easier part of my existence. Living with diabetes, on the other hand, is hard for me every day. Waking up in the morning and battling the brand new day is frustrating, and it's hard to make it through each day and maintain positivity and know that, my hectic day with some high blood sugars, it'll be okay.
I have to bring my own snacks to my friends' houses. I have to bring cupcakes to school and for birthday parties.
A lot of times I want to pre-bolus and get my insulin active before a meal, but if I don't know what's going to come out, if it's something I can eat, if there's the chance of cross-contamination, or if it's completely contaminated with gluten, that's when it really affects my diabetes, because then I have to drink juice or eat things that I wouldn't normally eat for a meal to make sure that my blood sugars don't go low.
The other thing I'd really like to talk about is how type 1 diabetes and celiac disease affect the family. You're dealing with two autoimmune diseases that have a big impact on the family, and some people don't quite know what to do. Do we remove gluten from the whole household? Do we still allow our other children to eat glutinous foods? How do you balance that without placing the burden of the disease upon the entire family? We found with our family that it was a matter of time, and we did it quite slowly. But eventually everyone in the family started to notice that they didn't feel so well after all when they would start to eat gluten. That transition period enabled us as a family to wrap our heads around new changes and that in fact that we could all embrace them and that it was good for us.
Meals are an important part of our culture, whether it's gathering with family and friends or going out on a first date out to a restaurant. And that's not something I realized was so ingrained in our culture until after I had celiac disease. And it was a big part of my dating experience because I could count on two hands the number of things that could go wrong with celiac disease. The person would pick a restaurant I couldn't eat at. I would go and not find anything on the menu. The food would come out and it would make me sick. The food would come out and I would know that it wasn't going to be able to be gluten-free, not something I could eat. And also the conversation about celiac. When do you bring up that you're gluten-free and that's the way you're going to be probably for the rest of your life? It's hard to do. And I was really lucky with my boyfriend. He immediately understood what celiac was and what diabetes is and adjusted to it. It was no big deal at all for him to often eat gluten-free and be able to support me in living with celiac and diabetes.
Living with diabetes and celiac disease in college is really difficult. The combination of the two really puts an extra burden on each moment. Not only am I thinking about what's my blood sugar, is it going up, is it going down, what do I need to do next? Have I taken my insulin? Did I remember to put my insulin in my bag for the day? But on top of that, it's not like I can stop at the closest restaurant, grab something to eat at lunchtime. I have to wake up an extra half an hour early in the morning so that I can pack my lunch to go with me.
Eating out, especially with the celiac disease, can be a lot more challenging, whether it's eating at a restaurant, eating at a friend's or acquaintance's house, or eating at a catered event. I need to be able to explain my need to be entirely 100% gluten-free and then trust that the person is going to understand that and be able to apply what I've been asking them. For me, those actions of self-advocacy don't come naturally, and I find it quite challenging.
I think the biggest challenge would probably be the weight gain. I was really surprised at what happened when my body began to actually absorb the food I was eating. I actually had a 50 to 60 pound weight gain in the first year after my celiac diagnosis.
I was just coming out of my honeymoon period with diabetes and was taking less than 10 units of insulin per day. And after I went gluten-free and my gut started to heal enough for me to start absorbing the food that I was eating again, within a couple of months I was taking upwards of 50 units per day. I also gained about 30 pounds within 8 months of my celiac diagnosis.
As far as advice tips go, it would be to really try to get to the bottom of the physical ailments and lab work. Celiac disease is very difficult to diagnose. It does affect diabetes control if you have a constant inflammatory state, and it also increases the risk of developing other autoimmune diseases in the process. So be your advocate and really try, and your child's advocate, and really try to get to the bottom of this celiac disease diagnosis, because it can be a push and shove for a number of years, and your child might be complaining of a bellyache on a regular basis, and there's nothing normal about that.
For as hard as things get sometimes, you always have to know that you can do this. And every day is going to be difficult, but the day is going to finish and you're going to accomplish great things.
I wish people had told me that it's not just the widely marketed gluten-free products that are good for people with celiac. I wish I'd figured out that a lot of naturally gluten-free products are just fine for people with celiac a lot sooner. It probably took me a year or so before I really felt comfortable exploring ingredient labels in the aisle of the grocery store, taking up space in the grocery store for a lot longer than anybody else did, and really figuring out the foods that worked for me. I think it's important for people with celiac to spend a lot of time in the grocery store, read the labels, figure out what products work for them, request things at their local grocery stores if it's not something that's regularly carried, and figure out ways to make it work for them.
If I were to say something to another diabetic celiac, entering college or in college or at any point in their lives, I would say that you need to see the big picture. There are so many things greater than you and greater than the micro existence of managing your blood sugars and remembering to eat and taking your chicken out of the freezer.
I guess my biggest advice would be to find a community of support. Find other people who face the same challenges and share ideas with them, gain insight from them, and don't be afraid to try new things. What advice do you have for somebody else who has both diabetes and celiac?
Stay positive, stay in school, bolus, and check your blood sugar often so that you can catch your lows and your highs.
Good advice.
I guess my one suggestion would be to learn as much as you can about both diseases, and both on the technical and scientific side of things, but also on the emotional side. And that means connecting with other people who are living with them. And there are so many ways to do that now, either in local support groups or online, on Facebook groups, on Twitter chats, on online forums. And I guess the last thing to say is that you can do this. If I can do this, you can do this.
You can do this. Type 1 diabetes and celiac disease together is a challenge. It has its difficulties, but you can do it.
You
Can
do
this!
Addy, I think we're done.